Knock, knock, knock. Hi, how are you?
Good, how are you?
Good, my name's Kaylee. I'm a student nurse at Cedar Crest College. Could I have your full name and date of birth, please?
Mr. Valentine, XXXXXX.
Okay, nice to meet you, Mr. Valentine. Could we move to a private location? It's a little loud in here. Okay, that's a lot better. So I've been asked to come here to teach you today a little bit about your newly prescribed medications. Metoprolol 25 milligrams by mouth daily. That is to prevent another heart attack. And then you have also been prescribed insulin glargine, which is 10 units subcutaneous injection daily at noon, and that is for your hyperglycemia. Is this correct?
Yes.
Okay, and before I start teaching, there's a couple questions I'm going to ask you. Is right now a good time for you to learn?
Yeah.
Okay, and are there any cultural considerations I should be aware of?
No.
And are there any physical or mental barriers I should be aware of?
I'm farsighted and I forgot my glasses at home.
Okay, I have a magnifying glass here today to help us with the teaching, so that'll help us later. So I'm going to start by going over your medications you take at home. So you take aspirin 81 milligrams by mouth daily. That's for your artery blockage. You also take Plavix 75 milligrams by mouth daily. That's also for artery blockage. You were taking metformin 500 milligrams by mouth daily. That was for your hyperglycemia, but now that's been discontinued and you're on to insulin glargine, the 10 unit subcutaneous. You also take lisinopril 25 milligrams by mouth daily, and that's for your hypertension. And you also take albuterol rescue inhaler as needed, and that's for your asthma?
Yes.
Okay. So a couple things we're going to be mindful of is now with the metoprolol and the lisinopril, there is now a risk of falls for you. So there's fall risks related to hypotension as manifested by the metoprolol and lisinopril combination. So lisinopril is an ACE inhibitor, metoprolol is a beta blocker. Both of these things will actually slow the heart rate down, causing hypotension, which is a low blood pressure. So with this, we have a few goals. I have a few goals for you today. So one of them being to always have your call button by your side, which we will provide for you, and for you to use it for whenever you want to get up and out of bed, okay? The second thing that we want you to have, the second goal we have for you is when you do get up, when you do get up out of bed, we would like you to sit up first, kind of collect yourself, assess for any dizziness before you get up out of bed, okay? And when you do get up to go out of bed, you're going to put your hands on the side of the bed and you're going to push off the bed, okay? And lastly, the other goal for you would be to always wear your non-slip socks that the hospital has provided, okay?
Mm-hmm.
Okay, so do you know anything about insulin glargine?
No.
Would you like to learn?
Of course.
Okay, so insulin glargine, otherwise known as Lantus Solostar, is a long-acting insulin. It's also an anti-diabetic drug and pancreatic type drug. So with this, you do have type 2 diabetes. So with type 2 diabetes, you do have insulin. It's just not as effective as it normally is. So insulin will normally regulate blood sugar levels. So it'll stop it from spiking too high, getting like hyperglycemia, which is high blood sugar, which is what you have been dealing with in the hospital.
Mm-hmm.
So insulin glargine is actually going to lower the blood glucose levels, which we now have to be mindful of hypoglycemia, which is low blood sugar. So some of the adverse effects are hypoglycemia, anaphylactic shock, and like redness and swelling. So just be mindful of that. And with the hypoglycemia, another thing, combined with metoprolol can actually, since it's a beta blocker, can mask the signs and symptoms of hypoglycemia. So some signs and symptoms to look out for would be dizziness, confusion, shakiness, irritability, and mood changes. So if you're kind of witnessing or experiencing any of those, that could be a sign of hypoglycemia. And because of that, we want you to be checking and looking at your blood glucose levels a lot more frequently. Another thing to be mindful of would be there's a natural product called glucosamine, and this interacts with the drug as well. So just be mindful of that, okay?
Mm-hmm.
So now that we're done with the teaching, we're going to move on to the demonstration. So I have some teaching with this as well. So with insulin glargine, or insulin in general, you're going to refrigerate your insulin, and then you're going to take it out and you're going to roll it in your hands. Sorry, I'm going to perform hand hygiene. Always perform hand hygiene before you do this, okay? Since we're injecting into the skin. I'm gonna wear gloves. You do not have to for this. And then you're gonna roll it in your hands like so. Slowly, just to mix the solution, okay? Then you're gonna put it on a surface. So some learning points with this or injection sites would be your belly. So you're going to take about a 1 to 3 inch, you're going to take about, or pinch 1 to 3 inches of the skin, and you're going to inject 2 inches away from the umbilicus or your belly button area. And you're going to also remember to rotate injection sites to stop any tissue damage. So you can also inject in the back of your arms, which is going to be hard for you to do by yourself. So if you have someone to help, that would be great. And you can also inject in the fatty sides of your thighs, okay? So those are just common injection sites. You also have an insulin needle here. This is a 31 gauge 5/16 inch needle. This is 50 units, okay? So what you're going to do is you're going to uncap this. Oh, just kidding. Actually, no, that's fine. You're going to uncap this. I'm going to actually not. Hold on. I'm going to scoop and swoop here 1 second. The first thing you would like to do is you're going to take a antiseptic wipe. This was already open for practice. And then you're going to sterilize the vial. And then you're going to take another one and you're going to sterilize the injection site. And now you're going to take this off. You're going to drop 10 units of air, because 10 units is how much you're on for insulin glargine. And you're going to now put this into the vial, inject, push in the air, and now you're going to take out 10 units of insulin. You're going to flick it just to get rid of air bubbles. You don't want air bubbles. And then you're going to take the skin and you're going to pinch about the 1 to 3 inches, and you're going to inject at a 45-degree to 90-degree angle, like that. And once you're done injecting, you're going to let go to release the skin, and you're going to inject slowly. You're going to take an antiseptic wipe. You're going to remove this slowly, and you're going to massage the area. And now you're going to use the scoop and swoop technique, like so. Never just put the cap on, because sometimes this could result in the needle coming through the lid and then stabbing you, and we don't want that. So now if I could see you try it, that would be great. Okay.
And how many units?
10 units. Can you see that?
Yes.
Okay. Good.
And you pinch the skin?
You pinch 1 to 3 inches and inject at a 45 to 90-degree angle. Okay. And another thing, so when you're at home, you're going to dispose of all of your needles in an empty laundry detergent container. I don't happen to have one on me right now, but that's how you would dispose of these needles, okay?
Okay.
All right. Do you have any comments, questions, or concerns?
No.
All right. It's been really nice to meet you, Mr. Valentine.
Thank you.
Thank you.